Hello everyone. So I've been getting a lot of requests for my follow-up video and it's finally here. It's a little bit later than I thought it was going to be, but I'm ready to give my review of how my 1 year has been with Mirena. I hit 1 year on August 1st, 2023 from having it placed, and it's been a roller coaster. It was hard in the beginning. Like I've said in previous videos, in the beginning, there's pain, there's cramping, there's odd sensations of things, because it gets inflamed. Everything gets irritated. It's like, what's this thing? But after that, it starts to subside, and every month was a little bit different. Some months were really pleasant and some months were really not. For pain wise, oftentimes I could get away with 400 to 600 milligrams of ibuprofen, which before Mirena for me was almost impossible. I mean, there were days, I would say at least 3 to 4 days a month I was bedbound. And not just from cramps, but also from heavy fatigue, from general like sickness and migraine, and I would get aura and kind of go blind on my left side, and just all kinds of stuff, all kinds of issues that I had. And since I got Mirena, I have had much less frequent migraine. They have become less painful and more easily taken care of with my regular Frovatriptan that I take. They're usually gone within an hour at that point after I take the medication. Sometimes they don't even require it. They'll go away on their own. That's not every time, but it's most of the time. And for me, that in itself is new and fantastic. And then as far as my menstrual cycles, the cramping that I would be so bloated. It was awful. It was horrendous. It's like a soccer ball. But now it's to the point where that's not even close at all. It's so tolerable. And then the cramping, like uterine cramping, non-existent. Does not exist, does not happen. What I do have still is ovarian pain with ovulation, which is completely normal. Ovarian pain are like tissue kind of sensitivity around the pelvic area when the time of the month is coming with PMS type stuff, totally normal. This has taken me down from severe PMDD to manageable PMS. I also take sertraline. That helps me with the anxiety and depression issues that can come with menstrual cycles. My OBs have been trying to tell me that for years, and I was difficult and did not listen. And it has changed my entire life. And then partnered with the Mirena, I wouldn't do anything differently. I will say it is, like I said, some months are heavier, some months are lighter, but it's never the heavy period I used to have. It's never that. Never. Not once. Since getting it placed. And to me, that is all the proof that I needed that I made the right decision. I've never had kids, so my OB did ask me if I wanted the smaller version, which is Kyleena, and I said no. If we're going to do this and it's going to hurt, we're going big or we're going home, and it is Mirena for me because I want it to do its job the first time. I'm not saying Kyleena won't. I'm saying that to me, I wanted the strongest dose because that's what I felt I needed. My quality of life was so bad that I wasn't willing to even try the lower dose. I was not willing to even try it. So that was important to me. Yeah, after a year, I'm really happy with it. I have recently had a stint of continuous migraine. I don't know why. We're doing an MRI to see if there's anything undercover that, may be causing these, not just hormone related. Because that's not typical. I mean, after Mirena, I went from 15 to 20 migraine days to 6-ish, maybe. So huge improvement. Again, no uterine cramps, minimal, if any, bleeding to spotting. But your first year is totally a ride of your body getting used to it, but it's not like a negative ride. Like, it's really not bad. I would totally recommend it based on my experience to anybody who wants to improve their quality of life and not worry so much about, unplanned pregnancy or anything like that, especially with how strict everything is getting. It could be a great option for you. Like I've said before, it's not medical advice. These are just my feelings after having had it placed. So yeah, if you have any questions for me, feel free to leave any comments or concerns, questions down below, and hit subscribe, and I will answer them and make any kind of follow-up videos. I was trying to think, for me, it's really the migraine, the uterine cramps, the bleeding. I mean, really everything has lessened, like I said. Mood swings, hot flashes, it's all lessened. So 1 year on Mirena has been a success, so we will see how it continues to go, and I will keep updating you. Again, ask me any comments and hit subscribe and follow, and I talk about other stuff than just Mirena, so